Haemophagocytic Lymphohistiocytosis, a rare but devastating condition for patients. There are four things you have to understand when it comes to terminology. Number one is HLH disease, where there is severe immune hyperactivation that is resulting from a genetic defect which could be related to cancers, infections, or rheumatologic disorders. HLH syndrome is where there is a specific genetic cause or an environmental cause, and there are not a lot of other associated conditions like infections, malignancies, or rheumatologic disorders here. The next one is MAS, which is mast cell activation syndrome. Now, this variant happens in patients who are already diagnosed with a rheumatologic disorder or juvenile idiopathic arthritis. The HLH 2024 criteria is used to diagnose this condition. I'm going to leave that up on the screen, pause this, and take a look at that. There was a study in 2004 which looked at about 369 patients, and the clinical findings of HLH were fever, splenomegaly, bicytopenia, hypertriglyceridemia, hyperfibrinogenemia, and of course you have the hemophagocytosis, the natural killer cell activity is lost, and then you have elevated CD25 levels. When you have to send off some lab investigations for these patients, remember that your liver enzymes are going to be more than 3 times above the upper limit of normal. You will have in turn abnormal coagulation as well. There are really high levels of ferritin in this disease, high levels of fibrinogen, and don't forget the bicytopenia. And the most common lineages that are affected are going to be the hemoglobin and the platelets. When it comes to evaluating this disease, naturally beyond a basic metabolic panel, you would have to do additional tests as well. So you would have to go for an MRI of the brain to look for parameningeal infiltrates, subdural effusions, any areas of necrosis. You would have to do a lumbar puncture for cellular pleocytosis. And then you can see some evidence of hemophagocytosis in the lumbar puncture as well. Naturally, a bone marrow is going to be tested as well for evidence of cytopenias. And then the hemophagocytosis is very evident on the bone marrow as well. When it comes to a treatment of HLH, you would obviously have to target the underlying condition that is associated with it, which is the malignancies or the rheumatologic disorders. But then there is HLH-specific therapy as well that you would have to consider. So the two main drugs that are used are dexamethasone and etoposide. If there is evidence of CSF involvement, you would have to use intrathecal dexamethasone and methotrexate as well. Remember that etoposide is quite hepatotoxic, so in patients who have severe hyperbilirubinemia, you would have to alternate etoposide for another medication called alemtuzumab, but we'll leave that to the specialists. Next time you have a patient with these findings, try to think of HLH as well.